A Vermonter recently returned from West Africa and has entered voluntary quarantine. And we're actively monitoring that individual for fevers or symptoms of Ebola for 21 days that will be forthcoming at the request of the health department. I want to emphasize that this is a voluntary arrangement, and that this individual does not have an elevated temperature, has no signs or symptoms of illness, and is not a health risk to anyone at this time. It's important to remember that an Ebola cannot be passed to anyone, the infection, until he or she has symptoms. And therefore, you would have to have direct contact with the bodily fluids of an individual in order to contract this particular disease. It is not an airborne virus. The reason for the requested quarantine is that this individual was in Guinea and Sierra Leone with a stated intention of investigating the Ebola epidemic in those countries. He's represented himself in public statements as a physician, but he's not licensed as a doctor or healthcare professional here in the state of Vermont. He was not traveling or affiliated with any government, public health agency, medical or aid organization. Factually, when he landed back in New York at JFK yesterday, around 2 o'clock in the afternoon on October 27th, we met him there with members of Vermont's law enforcement and public health and transported him back to Vermont. We're grateful to him for understanding the importance of monitoring his health twice a day for the coming period that will be deemed necessary. We all know by now that that means taking a temperature twice a day and checking his vital records.